So, what happens when a hormone that's designed to help you, to save you from stress, actually starts to turn against you? Well, today we're going to dive deep into that very question as we explore Cushing's syndrome, a really fascinating condition that's all about a hormonal overload.
At its heart, Cushing syndrome has a more technical name, hypercortisolism. And it's one of those names that tells you exactly what it is. Hyper just means too much, and cortisolism refers to, well, cortisol. It's a state where the body is literally flooded with this one hormone, and that kicks off this whole cascade of really dramatic and, honestly, puzzling changes.
Okay, so that naturally brings up a pretty important question, right? What exactly is cortisol, and why does having way too much of it mess things up so badly? To figure that out, we've got to meet the main character in our story today. You've probably heard cortisol called the stress hormone, and that's a little misleading. See, it doesn't cause stress. It's actually the complete opposite. It's your body's #1 tool for coping with stress, whether that's a physical injury or something emotional. It's what gets you ready for that classic fight or flight response.
So where does this stuff come from? Well, it's made in your adrenal glands, these little glands that kind of sit like hats right on top of your kidneys. And if we were to slice one open, we'd see it has layers. The outer shell is called the cortex, and bam, right there in the middle layer of that cortex, that's our main cortisol factory. All right, so we have this factory, but how does it know when to turn on and when to turn off? I mean, it's not just running 24/7, right? It's all managed by this incredibly precise system, a chain of command between the brain and the glands that we call the HPA axis. And the whole process kicks off right in your brain. There's this tiny little area called the hypothalamus. You can think of it like the body's central command center. When it senses stress, it sends out the first memo, a hormone signal that basically says, hey, we might need some backup down here.
That first memo goes a very short distance, right next door to the pituitary gland, which is kind of like the body's general manager. The pituitary gets the message and then sends out the real marching orders, a different hormone called ACTH, releasing it out into the bloodstream.
So this ACTH hormone travels all the way down to the adrenal glands. It's the final command. It basically knocks on the door of that cortisol factory and says, all right, time to get to work. Release the cortisol.
Okay, but here's the really brilliant part. How does the system know when to stop? Well, it has this beautiful built-in off switch. Once there's enough cortisol floating around, the cortisol itself sends a signal all the way back up to the brain and says, hey, mission accomplished. You can stop sending orders now. This is what we call a negative feedback loop. It works just like a thermostat, keeping everything in perfect balance.
Right, so what happens when that thermostat breaks? Or when that off switch just stops working? What if the factory just keeps running and the system starts to overflow? Well, that is exactly what happens in Cushing's syndrome.
It turns out there are basically two main ways this can happen. The first, and by far the most common, is what we call an exogenous cause, meaning it comes from outside the body. This is usually from taking high doses of steroid medications, like for asthma or rheumatoid arthritis. The other path is endogenous, where the problem is coming from inside the body itself.
Now, when it's an internal cause, this is where the medical detective work gets really cool. Doctors can figure out where the problem is just by looking at the hormone levels. Think about it. If the messenger hormone ACTH is high and cortisol is also high, it means the pituitary gland in the brain is the one shouting the orders nonstop. But if cortisol is high and ACTH is super low, what does that tell you? It means the brain is screaming stop, but the adrenal gland has gone rogue and is just pumping out cortisol all on its own. So what's the big deal? Well, this constant, unending flood of cortisol puts the body into a permanent 24/7 state of stress. And that, as you can probably imagine, leads to a really unique and pretty recognizable set of signs and symptoms. Yeah, when cortisol is always high, it starts messing with pretty much everything. It jacks up your blood sugar and your blood pressure. It tells your immune system to take a long vacation. It can even change your mood and make your bones weaker. Seriously. No part of the body is left untouched. And one of the most classic telltale signs is what it does to body fat. It's a little strange. It literally starts moving fat around, taking it from the arms and legs and packing it into the torso, the upper back, and the face. This leads to what's known as central obesity and that characteristic round, full moon face. And here's the paradox. While the middle of the body is getting bigger, the arms and legs often get noticeably thinner. So why does that happen? Because all that excess cortisol is also telling the body to break down muscle protein for energy.
It's a process called muscle wasting.
It doesn't stop there. Your skin takes a major hit too. Cortisol breaks down collagen, the protein that keeps skin strong and elastic. Without enough of it, the skin gets really thin and fragile. This leads to easy bruising and the appearance of these very distinct, wide, purplish stretch marks because the skin is literally too weak to handle the stress.
Okay, so with all these signs pointing to a problem, how do doctors actually diagnose and then manage the condition? Well, the absolute #1 key is to find that root cause.
And the treatment plan is completely tailored to what's causing it. If it's from those steroid medications, the dose has to be very slowly and carefully reduced. If it's a tumor on the pituitary or the adrenal gland, surgery is often the best option. And in some cases, there are medications that can actually go in and block the cortisol factory from working.
And for anyone who's on long-term steroids, this is probably the most critical takeaway. You can never just stop taking them suddenly. That's because your body's own command system has basically gone to sleep. It's been dormant. The dose has to be tapered down gradually, sometimes over weeks or even months, to give your natural system time to wake back up and start doing its job again.
So, when you look at the whole picture, the story of Cushing's syndrome is really a powerful lesson in balance. It shows us how a hormone that's designed to protect us, to help us survive, can become harmful when its delicate, tightly controlled system gets thrown into chaos. It really reminds you just how fine that line can be.